Hi guys, Victoria here. Welcome back to the third of 3 parts of Mirka's core therapy treatment. In part 1, you saw the kinesiology muscle testing plus the repatterning of her spine, etc. Then in part 2, you saw the Anmo Fu deep abdominal Chinese massage, which is so healing. And today in part 3, you get to see the finale, the cranial balancing, techniques that you may not have seen before. I used some with Hannah in another core therapy treatment that you will have seen on this channel. But today they're slightly different techniques and they're more aligned to stress relief and to make sure that everything is working perfectly so that she can function to the best of her ability physically, mentally, emotionally and spiritually. Okay, thanks for subscribing.
So welcome back guys, this is the third of the 3 parts of Mirka's treatment. Having carried out the kinesiology muscle tests and a little repatterning tweenar and sacral float in the first edition, the second stage showed you the deep abdominal Anmo Fu massage to help clear the gut, which also clears the mind, really good for stress. And now I'm sitting at the head of the couch and I'm starting to get an idea of where any tension and stress lies, physical and mental, within the neck, the scalp, the cranium. First thing I do after I've had a little feel for what's happening is I introduce a line of upturned fingers from both hands into the area immediately under the occiput bone at the very head of the spine. Now it's interesting, the spine doesn't stop at the base of the neck. The neck is part of the spine, and in fact when you look at a skeleton you notice that the top of the vertebrae, which is the atlas and axis 2 vertebrae, reach all the way up halfway into the back or inside our heads, and that's how it manages to support our head. Not by holding it underneath, but actually holding it within. So you can see how our necks can feel very tight. All the muscles, the sternocleidomastoid, the erector spinae, can feel very tight from the weight of our heads and our bones, our brains, our craniums. So to have a neck release done for you, where you release all of your muscles and trust and give in to the therapist, is one of the most releasing, cathartic feelings that you can achieve, in my mind. So having done 2 or 3 neck releases to the back while her head was aligned at the front, I now turn her head gently and I'm looking and feeling with my thumbs and my fingers how the 7 bones of the cervical vertebra, the top 7 vertebra of the spine, which hold the neck, I'm feeling for whether they feel in line with each other, whether they feel soft, whether they're malleable, so that the strong muscles and discs are able to move slightly left and right, if only a fraction. That tells me that the health of the neck is good, that it can support good brain function, nervous function, that the blood flow to the neck and head is good. This action where I push on the top of the deltoid is to see whether the arm bounces back. And you can see that's a really good bounce back there. I turn the head a little more, do the same again, and yes, that's a really good bounce back. That shows that the shoulder has loosened during the treatment, but also, most importantly, that Mirka is trusting me. That her body, even her subconscious, is able to let go, to release to the couch, release to the core therapy treatment, and allow the treatment to have an effect. I'm testing the other shoulder here to look for that important bounce back. Again, it's good there. And now I'm doing a really good long and strong stretch, pushing the shoulder down while my other hand is holding firmly under the occiput bone, which is the very base of the back of the head. Using both hands now with thumbs and fingers, massaging the muscles either side of the vertebra. And another neck stretch. You can see my fingers there are deep into the joint between the occiput bone and the top of the neck. This is so lovely to receive. What I'm aiming here is for the head just to tilt back, sometimes slightly, and sometimes it will tilt back quite a long way, almost as if the person is looking at the back wall. So yeah, this feels really good here, right into the neck, the base of the cranium, massaging the muscles. Now I've moved on to the next part of the treatment, which is Qigong. Qigong is a beautiful, healing, deep energy treatment. It uses the healing mechanism of the person's own system to be stimulated and onward carry on the healing treatment far beyond while Mirka's on the couch. So I've got my fingers and palms underneath her neck, the top of the neck into the cranium. My thumb has now come round to the sides of the temporals. So this is a treatment where I'm tuning into the length of her vertebra. I'm picturing and feeling into the energy of what each vertebra is doing, one by one, starting at the very top, working through the 7 cervical vertebra, the 12 thoracic, the 5 lumbar, the 5 fixed sacral vertebra, and finally the vertebra that make up the coccyx, which can vary. Apparently it can be between 2 and 5 mini fixed vertebra within the coccyx. And as in my mind's eye and my fingers, I'm feeling and tuning into whether each vertebra is movable and aligned. If I get stuck at one, I will simply tune my energy into that area and ensure there is warmth and movement before I then continue down the spine. By now, Mirka will be deeply relaxed. Most people see beautiful colours of the rainbow behind their closed eyelids at this stage. Those colours can happen at any stage during a treatment, but most people will see them during cranial work. Because of a little stress in Mirka's life, I'm now making sure that I focus on that area, but also because it came up during her abdominal massage, because of the AP, the anxiety point, was not quite functioning. This is a beautiful, relaxing technique with Qigong, which is the frontal float. The frontal bone is our forehead bone. I've also got my hand directly underneath her head, rather than her neck. And I'm feeling into the energy between my hands. And although it looks like I'm moving or have moved her head over to one side, in fact, what has happened here is her head will move in the direction it needs to. You know that when we're asleep, when we are resting at night and we first get into a comfortable position, if you're lying on your back, notice how your head tends to turn to one location. Not often we're happy in the centre. Because of the weight of our head, we often want to turn left or right. And maybe notice what you do next time. Maybe you have a preferred place. And for Mirka at the moment, it's to her left. I'm not pulling her head at all here. What I'm doing is allowing her time to move in any direction she wants to move. Her head has wanted to come up to a central location again. Sometimes people will move more quickly than this. Sometimes they just go to one place and stay. Sometimes they'll move left and right, and maybe stay in each location for a minute or two. Mirka's intention here, I can feel it through my hands, is wanting to come slightly more left again. I'm not holding strongly at all. This is a very light touch. Obviously, her head is quite heavy on my right hand, but my left is holding very lightly. The energy, the colours are absolutely beautiful at this stage. Most people will see colours of purple and green, which tunes into the third eye chakra and the heart chakra. Quite often these will be seen together because healing and therapy is being given. Once the head has moved to a place that is central again and is happy, I then want to make sure that other Qigong treatment that can help with stress and anxiety is now being performed. I've got one hand on her frontal bone and the other very lightly on the bridge of her nose. I've just got 2 fingers, my thumb and index finger, touching across the top of her nose. Mirka is very deeply relaxed by this stage, and what this type of technique will do is it helps with respiratory, sinus, headache, clarity, vision, and sleep. By clearing congestion, and not just physical congestion of the sinuses, but also mental congestion, mental inflammation. By clearing these areas, it really helps us to see life more clearly and feel lighter and fresher. Now, this is a beautiful last treatment that I'm doing within her Qigong cranial balancing work. I've got an index finger of each hand, one on her cheek, one on her frontal bone, the forehead, and then my thumbs on the frontal bone and the other cheek. And what can happen here, this technique is actually, we call it the jam jar treatment, is sometimes the cranial bones can feel stuck as if the top and the bottom of the cranium are working as one. But in actual fact, as we know when we breathe and our craniums inflate and deflate, each bone needs to work on its own accord, loose and soft. And I'm making sure that there is nothing stuck or too tight in this area. This really helps with stress. And now I slowly bring Mirka round. She will be so deeply relaxed. I ask her to take 3 deep breaths and then slowly move into her fingers, her soles, stretch her toes away, move into her shoulders by rotating one way and the other. And then working into the ankles. This stimulates the whole body. It reminds the brain of all the different parts of our body in that we can feel like each area is working as a team, as one. Now I'm asking her to breathe into her abdomen, her chest, and when she's ready, a nice long body stretch. This helps me too. It helps me to realign and stretch after being seated for a while and treating for a length of time. The last thing that we always do in core therapy is retest any tests that did not pass at the start of the treatment. I check my notes to see which areas need retesting. The first one is an IPSI test, which means one-sided. Oh, that's really good. I put a lot of pressure on them. That was so good. I'm testing the contralateral that did not pass earlier. Both were excellent passes, really strong. So that shows really good for her hips, for her walking gait and her joints. Now I'm testing into her hips using her right leg as a strong indicator muscle, an SIM. These are all really good. I'm putting a lot of pressure on them. If anything, I'm putting more pressure than I did at the start, just to show Mirka and her brain that there are some strong passes there, that she will feel so much better. Now I'm testing for the 3 areas which I tested at the end of the Anmo Fu, the deep abdominal massage, the 3 areas that were not happy earlier. A little bit weak there, but much much better than earlier. So that was the ICV. Now we're testing the Houston valve. Nice and strong. So the only one I'm still a little bit concerned with is the ICV, and I book an appointment with Mirka for a few days' time to treat again her ICV. So thank you so much for joining me. Really appreciate you subscribing and commenting. I'll see you again next week, where I will show you the next in my series of my latest therapies. Thanks for watching, guys.